I'm Casey, and I'm going to do a quick down and dirty on what we need to do if we need to set up an art line and all the steps that's going to go into it. So when a doctor's going to be putting in an art line, this is the kit, which we have in various critical rooms and in storage. And the doctor's going to be doing his thing over there, and your job as a nurse is to be setting up the tubing and getting it all ready under pressure, so when it's time and he's ready and he's sterile, you can hand it to him and connect it. A couple things about art lines that you have to pay attention to is you're essentially reading a blood pressure in real time under pressure with the machine. So it's really simple in terms of nursing on what supplies we need. We need the vamp, a pressure bag, a 500 fluid, normal saline is what ICU wants, the connector cord, and then a clamp. So a couple things about art lines that you have to pay attention to is you are basically reading a blood pressure under pressure, and then it's transmitting it onto the machine. So for that to read accurately, we need to do a couple things, which is going to be burping the bag and then priming it so there's absolutely no air bubbles in the vamp. And there's a couple tricks that I can go over to help you do that successfully. The first thing that you're going to do is, when you open all this, much like normal IV tubing, is you're going to go back to your old school nursing days and burp the bag. And I can edit. So you're going to get all the air as much as possible out of the bag and do that. The thing about this tubing is it doesn't prime to gravity like normal IV tubing does. You are going to make sure there's absolutely no air bubbles in it. Then what you're going to do is you're going to look for the pigtail, the blue pigtail, and on one side is going to be the hard wire and on the other side is the soft. And the way you remember it is hard is up. And then you put it in. After that, this came extended. You're going to push it in so that there's no air gap here. Once you have it set up like that, all you do is you pull this pigtail and you'll see it starts to pull the water all the way through. And you're going to keep flushing it and flushing it until it reaches the very end, and you're going to get any sort of air bubbles out of the wire. So. Okay. That is all primed. That is when you're going to hang it under pressure. So you're going to slip it into your pressure bag.
Ten years later.
Okay, so once you push it so much that the green finally comes out, it's fine. You know that it is ready to go. So just to kind of go over everything again, you burped the bag to get the air out, then you spiked it, you hung it to gravity, you put the vamp in the clamp with the hard side up, then you pulled the pigtail and flushed it and primed it. Before you did that though, you made sure this was closed. And once you've got it all primed, technically it's ready to be used. You're just waiting for the physician to finish putting in the art line. It's ready for you to hand them it. You're going to give them this end, which they'll attach to the art line that they have put in the patient. So if we can just pretend that is connected. Your next job is to find one of these, put it in the monitor, and then you're going to attach it. It goes in here. Now, we're not done yet. So what we're going to do next is you have to zero it, which means basically you're taking the pressure from the outside air and making it match within the closed unit because it's closed and attached to the patient at this point. And that's what's going to give you the ability to read the pressure in real time. So if we just have this off to the patient over here. And you're all ready, your art line's ready. So once this is completed, you've attached it to the patient and your phone a friend, nurse friend has attached this into the machine and you have to attach this into here. What you're going to do is you have to equalize the pressure from the atmosphere inside of here and to the patient. So it's kind of a two-person job. One person's going to be on the art line, the other person's going to be over here, and you're just going to have communication And you're gonna take this little blue cap that was involved, or was in the kit that you originally opened, and not drop it on the floor. And have that ready. Then you're gonna come over here and go over to the little stopcock. So if you remember, the hard part is up. This is the part that's going towards the patient. So when it comes time to zero it, you're gonna take this clear cap off, and then you're gonna turn it off to the patient, so up, and open to air. Once you do that, you're gonna burp this until a little drop comes out like you saw. And then your friend's gonna go over to the monitor over here, click on the red art line that's popped up, this part right here, and then you go to 0. You're gonna, technically, if this was attached to a patient, you'd see 0 completed like that. Once 0 is completed, you come back over, you take your brand new clean cap, you put that on, showing that you burped it basically, and you put it back off to air, and that's it. You should have a really good reading, and you saved a life.